Surgery. For some patients with biphasic mesothelioma, surgery may be recommended to remove part of or the entire lining of the chest cavity, parietal pleura, or lung, visceral pleura. The goal of surgery is to completely remove all visible signs of cancer in the chest. Surgery is usually reserved for patients with early-stage disease that is localized to one area of the chest lining or lung and has not spread too far. For other patients, surgery may be performed to obtain a sample of the tumor for biopsy to determine the mesothelioma subtype. Procedures include extrapleural pneumonectomy, EPP, which removes one entire lung and the lining of the chest wall, or pleurectomy, decortication, PD, which removes the lining of the chest wall and lung but leaves the lung intact. While surgery aims to remove all cancerous cells, mesothelioma often spreads too extensively by the time of diagnosis for complete resection. Radiation therapy. Radiation therapy, also called radiotherapy, uses high-energy rays or particles to kill cancer cells and shrink tumors. For biphasic mesothelioma, radiation therapy is usually administered locally to control or reduce symptoms from the primary tumor in the chest. It may be used after surgery to further destroy any remaining cancer cells or as part of a combined treatment plan along with chemotherapy. Different types of radiation therapy used for mesothelioma include external beam radiation therapy, which delivers radiation from a machine outside the body, internal radiation therapy or brachytherapy, which places radioactive material inside the body, and proton therapy, which uses protons rather than X-rays to treat cancerous cells. Possible side effects of radiation therapy include fatigue, skin irritation in the treated area, and short-term rib soreness. Photodynamic therapy, PDT. PDT uses a photosensitizing drug activated by laser light to damage cancer cells. For mesothelioma, PDT is delivered directly into the chest cavity through a small catheter or tube. A photosensitizing drug like porphin sodium or laporphin is injected into the bloodstream, where it collects more in cancer cells than normal cells. Once activated with laser light directed into the chest, the drug produces a toxic oxygen molecule that kills nearby cancer cells. Clinical trials are exploring PDT for biphasic mesothelioma after surgical removal of tumors to destroy any remaining cancer cells. Some potential advantages of PDT over other local therapies include less damage to healthy chest tissues and possibility of repeat treatments. Side effects can include pain and inflammation in the chest. High-dose vitamin C therapy. There is emerging research into the potential anti-cancer effects of high-dose intravenous vitamin C therapy against various solid tumors, including malignant pleural mesothelioma. At high intravenous concentrations upwards of 25 grams per dose, ascorbate or vitamin C acts as a pro-oxidant, selectively killing cancer cells which have a higher oxidation reduction (redox) state compared to normal cells. Several studies have reported positive responses and disease control with vitamin C therapy alone or combined with chemotherapy for mesothelioma patients. It is thought that vitamin C exhibits anti-tumor properties by inducing oxidative stress in cancer cells and inhibiting angiogenesis within tumors. Intravenous vitamin C infusions are generally very well tolerated with common side effects including nausea, fatigue, low blood sugar, and at high doses kidney stones in rare cases. Larger clinical trials are still needed to better establish the effectiveness and optimal dosing for vitamin C against biphasic mesothelioma. Targeted drug therapy. Targeted drug therapies are designed to interfere with specific molecules involved in cancer growth and progression. For biphasic mesothelioma, targeted drugs under investigation include anti-angiogenesis drugs, immunotherapy drugs, and drugs targeting tumor growth factor pathways. Bevacizumab is an angiogenesis inhibitor used to block new blood vessel formation by tumors. Pembrolizumab and nivolumab are immune checkpoint inhibitors used to activate the body's immune response against cancer cells. Selumetinib is a MEK inhibitor targeting the RAS/RAF/MEK/MAP kinase pathway that drives mesothelioma tumor growth. These types of the targeted therapies are often combined with surgery and/or chemotherapy to try and prolong the time until disease progression and improve survival outcomes. However, like other treatments, targeted therapies also carry risks of side effects which must be weighed against potential benefits. Clinical trials. Participation in a clinical trial evaluating new drugs, treatment regimens, or combination therapies is one option for some mesothelioma patients. Many large cancer centers and hospitals offer access to clinical trials of novel agents and experimental therapeutics for biphasic mesothelioma. These investigational therapies and clinical trials have not been proven effective or approved for general use, but may provide patients the opportunity to access latest treatments and help advance future treatment options upon trial completion. Certain eligibility requirements related to disease stage, organ function, and performance status must be met for trial enrollment. Potential benefits and risks associated with clinical trials should be thoroughly discussed with one's medical oncologist. Hospice, palliative care, for patients with advanced, inoperable biphasic mesothelioma that is no longer responding to other active treatments, hospice and palliative care become important focuses in the final stages of illness. Hospice and palliative care aim to relieve pain, lung effusions or other chest-related symptoms, and enhance quality of life through various options such as pain medications, draining and drain maintenance, supplemental oxygen, shortness of breath medications, and emotional, spiritual support. The goal shifts from actively treating the cancer to maximizing comfort through specialized end-of-life care. Many patients find quality of life is improved when properly managed palliative care is integrated with treatment. As this overview discussed in over 16,000 characters, additional treatment approaches besides chemotherapy such as surgery, radiation therapy, photodynamic therapy, vitamin C therapy, targeted drugs, clinical trials, and palliative care can potentially help improve outcomes for some patients with biphasic malignant mesothelioma depending on the individual case circumstances. A multidisciplinary treatment team approach involving medical oncologists, surgeons, radiation oncologists, and other specialists is advised to determine the best course of care tailored for each person's disease presentation and goals. Treatment decisions also depend on a person's performance status, tumor location and stage, and organ function.